Post-traumatic stress disorder, as its name implies, happens after a trauma, after something so out of the ordinary happens to you, or you perceive it as out of the ordinary, that you internalize it in a way so that it affects you. It affects your sleeping patterns. You may have flashbacks of it. You may get depression. You may be triggered by things that seem irrelevant to it, but actually are connected in some way. We saw a lot of PTSD, for example, following wars, following 9/11. For other people, though, it's a singular event particular to them. For example, after a rape, people often experience post-traumatic stress disorder. Attack of that level of violence will mean that you're going to become extremely sensitized to danger, extremely traumatized by the possibility of what could be. I think someone who's undergoing post-traumatic stress is going to feel very agitated. There's a lot of anxiety. There's a lot of fear of trauma. They'll probably have very sort of fragmented memories of it, but focus on a specific area of what happened over and over again. We know that a lot of victims will often focus on the perpetrator's weapon, whether that was a gun or a knife, or their hands if they were being physically violent. Sleeplessness is very difficult. Very bad nightmares are very, very common. And the triggering of the memories over and over again. So while you're sitting around, you may feel fine, and then something will hit you, and it'll come back as a very, very vivid flashback. And that makes even the most simple things difficult to deal with. So, most people get up in the morning and go to work. If you have PTSD, it's a very difficult thing to do. Cognitive behavior therapy works very well with PTSD. Imagery, relaxation, and also sort of, again, graded exposure in terms of getting a realistic assessment of the danger implied is very, very important.